With the continued advancement of less invasive procedures, patients are benefiting from fewer complications, shorter hospital stays, and quicker recoveries. However, complex polyp resections are often still being done surgically. Difficult anatomy, lack of stability, and high skill requirements continue to challenge the full development of endoluminal interventions. In response to these challenges, Lumendi has developed the DiLumen Endoluminal Interventional Platform, which consists of a soft, flexible sheath that fits over standard and small diameter colonoscopes. DiLumen provides a conduit to the therapeutic site and employs two balloons to aid in colon navigation and stabilization of the anatomy and endoscopic tools. Once the endoscope and DiLumen are inserted into the patient, DiLumen is designed to serve as a conduit to the therapeutic site. The balloons are used to hold the device in a fixed position while the endoscope advances forward. Used in tandem, the endoscope and DiLumen can effectively reduce tortuous anatomy as the clinician navigates to the cecum. A reduced colon enables better control of instruments and the endoscope during therapeutic procedures. With the endoscope and DiLumen in position, the aft balloon is inflated first to stabilize the endoscope inside the colon. When performing endoscopic submucosal dissection, the clinician will begin with a submucosal injection to create a cushion. Dissection then begins by creating an incision between the mucosal and submucosal tissue and continues until a lip between the mucosa and submucosa has been created. The 4-balloon assembly and DiLumen DR dynamic retraction system, which includes 2 suture loops, is deployed towards the oral side of the polyp. A standard hemostasis clip is then used to join the suture to the front edge of the dissected mucosa. Gentle tension is applied, and the mucosal edge is lifted to expose the submucosal fibers under tension. Dissection continues under direct visualization and continuous tension until the polyp is completely removed. The DR dynamic retraction system is unique to DiLumen and may improve visualization and dissection time. Finally, the polyp and endoscope can be removed while DiLumen remains in position. Multiple insertions can occur throughout the procedure without losing position or having to spend valuable time navigating back to the therapeutic site. Lumendi proudly continues to partner with healthcare leaders around the world to further develop new solutions that improve patients' lives and reduce healthcare costs. For more information, please go to www.lumendi.com.